Hello everybody, this is Sharon Paulier, your instructor in the Fundamentals of Health Informatics course, T2060. Today we're going to deal with Module 5, the subject matter being barcode technology in healthcare. Hope you enjoy the course. So what is barcode technology? Barcode technology in healthcare specifically is the use of optical machine readable representation of data in a hospital setting. Just like you would scan groceries, same type of barcode scanning is used in healthcare. Barcode technology is used to promote patient safety by reducing medical errors. It's more accurate, it takes the guesswork out of an item. Barcode technology is used by many applications in a hospital, and we'll go into this as the course goes on. Now let's talk about some applications that use this type of technology, barcodes. First, it's used for drug identification and medication management. I'll get more into this in another slide. It's also used for specimen collection and blood transfusions. Another way to use it is surgical instrument identification and for sterilization purposes. And it's also used for patient identification. You'll see a barcode on a patient's wrist bracelet pretty often. The next topic I want to talk about is drug identification and barcode medication administration. Medication errors is a major problem in any hospital or healthcare setting. So this is taken very seriously. It's very important to reduce these types of errors. So barcode medication administration, also known as BCMA, is an inventory control system that uses barcodes to prevent human errors in the distribution of medications. The goal when you're administering medications is to make sure of the 5 rights, as they're called. You know, the right patient, the right medication, administered at the right time, at the right dose, and by the right route. So how does this all work, BCMA? Well, barcode medication administration consists of the following. It consists of hardware and software. So there's a barcode printer, where we actually print the barcodes, a barcode reader, also known as a scanner, where we scan the barcode, a computer, could be a mobile computer, and then the computer server and software, which is running the application in the background. So each drug is labeled with a unique barcode. When the nurse or tech at the time of administration, the clinician will scan the barcode on their own ID badge, thus tracking themselves as the person administering the medication. They will also scan the patient's wristband, so to make sure they have the right patient, and they will also scan the drug. Everything is audited, everything's trackable. It just, again, is another way to reduce errors. So what are some of the benefits of barcode medication administration? Well, first off, as I've said several times now, medication administration errors are greatly reduced. It prevents medical errors as well, and by doing that, hopefully, it reduces mortality rates. Nurses are also affected because it improves nursing satisfaction. It allows for nurses to automatically document the administration of drugs by barcode scanning. So it's just everything is being done for them. Just scan the barcode, it's being documented. And because of all this, patient satisfaction is improving as well. It's a win-win situation. Specimen collection and blood infusion. Barcode helps labs tremendously. Clinicians use specimen testing such as blood or urine to help diagnose diseases and monitor medication levels. error-free collections means accurate results. So it's very important that the right specimen is received with the right patient information on it. So what happens is a physician will place an order for let's say a urinalysis, and the nurse will go to collect the specimen, the urine sample, but prior to that, a barcode label prints out with the patient's demographic information on it, and what the order is and what the test is, and this label is then placed on the specimen. So this reduces labeling errors of someone handwriting the label on the specimen, and it's the order, everything is right there on the specimen. So there's no handwriting analysis that has to be done. There's no mixing up of specimens because the wrong label, the wrong person received the wrong label. It just, reduces errors tremendously. So it helps ensure the correct patient is receiving the correct analysis. This decreases rework for both the nursing staff and the lab staff, and as well as the patients. They don't need to, if something happens with a specimen, they don't want to have to then produce another specimen. It also decreases possible delays in diagnosis of treatment. Continuing on with specimen collection and blood infusion, I just want to mention a few other items. Barcoding blood products reduces medical error and increases patient safety. According to the FDA, all blood and blood components must have barcode labels that contain the following. They need to have a unique identifier from where the blood is coming from, a lot number identifying the blood donor, the product code, and the blood type, AB, A, O, B, and the RH, plus, negative or positive. So everything must be labeled, labels must be checked, and barcoding has helped with this process tremendously. Another area in the hospital where barcodes are used are in surgical instrument identification. Barcodes are used to identify the instruments and supplies in the kits for surgical procedures. Each surgeon usually has a preference kit of what they like in their room on their kit for a specific procedure, and barcoding helps identify the instruments. It ensures compliance with surgeons' preferences of their kits. Barcodes also track what is and what is not used on a regular basis, allowing hospitals to optimize the kit contents. Sometimes, these kits need to be, reevaluated for what's in them. You don't want to keep opening up the same item and it's never being used. And it also helps to act as an inventory control. It helps reduce the purchase of supplies that are never used. And lastly, it uniquely identifies each instrument that is sterilized individually. It's very helpful in, the tracking and auditing of sterilization with regard to the surgical instruments. As I mentioned previously, patient IDs, such as wristbands, often contain barcodes, and it's an easy way to collect and track the patient's demographic information. Patients often wear wristbands with barcodes containing information such as their medical record number, their visit number or account number, their age, their sex, and other demographic information that has proven useful, depending on the facility. Barcode technology helps prevent medical errors by having information readily available and trackable at the point of care, such as drug identification, medication management, infusion safety, specimen collection. The list goes on and on. Very helpful in a hospital setting. So as I mentioned before, there's different types of hardware that are needed when using barcode administration. First, you need to be able to print barcodes. they're called label printers. I know I've worked in hospitals where there's a product called a Zebra label printer that we've used, specifically to print those small labels that contain barcodes. And equally important, once you print the barcode, you need to be able to read it. So now I'm going to talk about different types of barcode readers or scanners. So a barcode reader or scanner is an electronic device for reading barcodes. It consists of a light source, a lens, and a light sensor, which translate the optical impulses into electrical ones. It also contains decoder circuitry that analyzes the barcode's image data and sends content to the scanner's output port. And lastly, I'd like to talk about types of barcode readers. Barcode readers come in many different types of forms. There's a pen type reader, which is very handy. I've seen it used to scan like forms. There's laser scanners, CCD readers. There's camera-based readers. Often you'll see handheld scanners. You'll see those type a lot. There's a photo of that on this slide. Lately, even your cell phone cameras can act as a barcode reader. Smartphones have them, as well as PDA scanners. So you'll see different types, although they do the same thing, they read the barcode, you'll see them in many different types of forms. This concludes Module 5. I hope you all learned a little something about barcodes and barcode labels and barcode printers and how they're used in the hospital and other settings. And thank you very much.